Hi and welcome everyone on my comprehensive health and medical channel. Today we're going to talk about a very important medical issue. A lot of patients coming to the hospital and asking me, "Doctor, I'm getting hair loss. How can you help me?" Well, today on this video I will show you an important tips that you should follow to stop your hair loss. And now, before talking about hair loss, let's talk a little bit about hair structure. The hair shaft is made of a strong protein called keratin, and hair follicle anchor this hair shaft inside our skin, and they're what we call by hair bulb, which form the base of each hair that are responsible for the growth of hair shaft by cell division and blood supply. Our hair grows in average of 0.5 to 0.75 inches per month, and our hair color depends on melanin cells in a hair follicle. With aging, these pigment cells of our hair will die and the hair will start turning to gray. We lose about 100 strands per day. Hey dear, you need to pay attention. Of what? That you often see strands of your hair falling during your brush and shower. Major loss can be recognized when you're shedding more than 150 strands per day, or when there is a widening of part of scalp. What may affect our hair? First of all, mechanical influence, including combing. Back combing of our hair and the use of hair curler that make hair cuticle flake and tear. Wet hair are more susceptible as the cuticle are swollen. Also, extensive brushing can lead to tractional alopecia and cause dry, brittle hair breakage. Secondly, we will talk about the effect of environment. Light, including ultraviolet light and visible light, these can contribute to break down the chemical bonds within the hair structure. The third point is heat. You know, using of curling iron or straighteners or blow dryer or dryer hood, all of them can lead to breakdown of bonds between your polypeptide chain, which are the main structure of your hair. And overexposure to heat can damage your hair and damage your scalp, and finally will lead to hair loss. The fourth point, including coloring, lightening, can affect your hair cortex and lead to severe damage to your hair and lead to hair loss. Finally, health problems. People who are underlying health problems such as hormone changes in pregnancy, menopause, or thyroid disease. People who are with scalp infection, with ringworms. People with chronic disease on medications such as cancers, arthritis, depression, and heart disease. And people with very stressful events, physical or psychological shock. Malnutrition or poor diet will lead to vitamin D deficiency and low levels of protein, and all of that will lead to hair loss. There are types of hair loss. Gradual thinning on top of head, circular or patchy bald spots, sudden loss of hair, full body hair loss, patches of scaling that are spread over the scalp. Before start talking about the treatment of hair loss, we need to know the cause of hair loss, and this will be by doing these investigations. In treatment of hair loss or any disease, we need to treat the underlying cause first. During that time, we should take supplements such as biotin with a dose 1000 microgram per day, and vitamin D. We first should treat the vitamin D deficiency, and if it was in normal range, we should take 2000 international unit tablet per day. And also we should use minoxidil. Minoxidil is a safe drug, and it is one of the over-the-counter drugs that can be used safely without prescription. It is a very important drug in hair loss. It will affect the blood vessels which supply the hair follicle and will lead to vasodilation, and this vasodilation will help to improve your hair growth. Thanks for watching. Don't forget to like and subscribe my channel, and I'm waiting for all your comments, and see you on other video.